evening, ladies and gentlemen. My name is Tracy Ratliff. Jennifer was diagnosed at age 29 with ovarian cancer, and she was diagnosed in the later stages because she did not seek medical attention when her symptoms began. Sadly, she passed away right before her 31st birthday, leaving 2 young children behind. Jennifer became part of the statistics that we hear about. According to the American Cancer Society, a woman's lifetime risk of developing ovarian cancer is 1 in 71, and a woman's lifetime risk of dying from ovarian cancer is 1 in 95. Each year in the United States, more than 21,000 women are diagnosed with ovarian cancer, and about 15,000 women die from this disease. I want to explain the symptoms of the disease. Symptoms include bloating, indigestion, abdominal pain, pelvic pain, difficulty eating, feeling full too quickly. Some of the other symptoms are fatigue, back pain, constipation, and menstrual irregularities. The earlier a woman is diagnosed, the higher her chance of survival will be. Now that you know the signs and symptoms, let me tell you how it's diagnosed. According to the CDC, if ovarian cancer is found and treated before it has spread to the outside of the ovaries, then her 5-year survival rate is 93%. But sadly, only 20% of ovarian cancer cases are diagnosed in these early stages. And did you know that you can get ovarian cancer even if you have had your ovaries surgically removed? So a woman who has had a complete hysterectomy still is at a risk of ovarian cancer. According to Dr. John Lockhart with Riverside OBGYN, the best means of early diagnosis is through transvaginal sonography. Additional testing is also done through CT scans, MRI scans, and ultrasound studies. After a growth is confirmed, you will be referred to a gynecologic oncologist. At that time, he will surgically remove the growth and have it tested. That is the only way to determine for sure if it is cancerous. As you can see here, this is a picture. Don't look at the artwork, but this is a picture that I drew of this here is a healthy ovary. This side should look the same. This is a cancerous ovary. You can see how much different it is. Now that you know the symptoms of and diagnosis, let me explain the treatment of this deadly disease. The first step in treatment is to determine the stage. The stages range from T1 to T3, with T1 being the best prognosis and the earliest stage. The next step will be surgery, chemotherapy, and oftentimes radiation. Other less common treatments are clinical trials and alternative medicine. As we conclude tonight, you have seen that ovarian cancer is a silent killer among women because it is difficult to diagnose and oftentimes misdiagnosed in the beginning. The earlier ovarian cancer is found, the better your prognosis will be, especially for patients like Jennifer. I certainly hope you leave here tonight with a better understanding of this devastating silent killer. Thank you. Are there any questions?
What is a transvaginal sonography, and is that something that is done on your yearly gynecological exam?
A transvaginal sonography is an ultrasound, similar to an ultrasound that a pregnant woman will have on the outside of the belly. It's the same type procedure, but it's done internally, so the doctor can see the ovaries, any fluid buildup, abdominal wall, anything like that that may be abnormal. And it's not typically done on a yearly, but if you're at risk, have a family history or something, you may want to ask him to do that.
Thank you.